Delta is now been replicating so much in the human population that we're seeing little subgroups of Delta variants.
This is In the Loop. I'm Christian Bryant. Hard to believe we're heading into the second flu season of this pandemic, and with highly contagious variants, many Americans might soon be adding a COVID vaccine booster shot alongside that annual flu shot.
COVID could still be ongoing, making people sick, and then along comes flu doing the same thing. We could have a twindemic this fall and winter.
Last season was one of the mildest flu seasons on record, but you also have to put in perspective where we were as a society. Pretty strict lockdowns and social distancing measures fully enforced. Things have gotten a little more lax since then. Of course, doctors still want you to get your flu shot, and starting next week, COVID-19 vaccine boosters could become available to all fully vaccinated Americans.
The plan is for every adult to get a booster shot 8 months after you got your second shot. Pending approval from the Food and Drug Administration, the CDC's Committee of Outside Experts.
And here's an extremely 2021 question that's coming up for a lot of folks. Can you get a flu shot and a COVID vaccine booster at the same time? Basically, can your body juggle that protection from the flu and COVID? The answer is yes, which is actually a change from prior guidance from the Centers for Disease Control and Prevention, which initially said to wait 14 days between the flu shot and a COVID vaccine. Now, with more research in hand, the CDC says it's safe to get them together. For what it's worth, Moderna is also working on a 2-in-1 shot that'll have a COVID-19 booster and flu shot in one. A 2-in-1 you won't get dragged for. With all this said, we're still waiting for the FDA to officially approve boosters, which could come very soon.
But I must say, from my own experience as an immunologist, I would not at all be surprised that the adequate full regimen for vaccination will likely be 3 doses.
For now, the US is currently only offering booster vaccine shots for people with severely weakened immune systems. The broader public is still in the waiting room. An FDA advisory committee meets tomorrow to discuss boosters, and the CDC meets next week to decide whether to approve a third dose of the Pfizer vaccine. But there's been some disagreement between the science and politics of booster shots. Some of that stems from the Biden White House's September 20th Boosters for All promise. Scientists seem to be split on whether a booster shot is needed right now. Some prominent FDA officials, including 2 who are resigning, think getting doses to the unvaccinated should take priority over getting a third dose to those who are vaccinated. Conflicting opinions aside, we wanted to know what science says about that third dose holding up against the Delta variant. Newsy's health and science reporter Lindsay Thies breaks it down for us.
Right now, it begins and it ends with Delta variant.
Andy Prakash investigates the replication and disease potential of respiratory viruses. Keeping him up right now, the future mutations in this variant versus vaccine race.
Delta is now been replicating so much in the human population that we're seeing little subgroups of Delta variants, so almost variants of the Delta variant, if you will.
He says there's not much we can do to stop the virus from mutating, but we can control how much copying of the COVID virus goes on.
If we limit the number of people getting infected, we limit the opportunities for that virus to accumulate mutations. That's where we as people can really step in with our public health interventions, with our vaccinations. We can lower the amount of virus that's replicating, and therefore we make it less likely that mutations that allow the virus to behave better will emerge.
So let's talk about vaccines. First and foremost, months of scientific data from study after study shows that both the mRNA and the Johnson & Johnson shots for COVID are not only safe, they are highly effective at keeping people out of the hospital or dying from the disease. But what about those breakthrough cases we've heard so much about, from U.S. senators to athletes to a cluster of people in Provincetown, Massachusetts? Those mild infections are an indicator of why Delta is ahead in the variant versus vaccine race. This is happening partially because Delta is more contagious, but also because
Delta's emerging anywhere from 3 to 6 months after most people have gotten immunized. And so your body naturally has slightly lower antibody levels that far from a vaccination. So Delta is seeing people that have slightly lower antibody levels.
What does the science show about immunity after about 6 months for 2 doses of the Pfizer vaccine?
After 6 months, the science is excellent. So another New England Journal study that just got published yesterday that got zero attention is that after 6 months, there was still high levels of protection with the Pfizer vaccine from the original participants in the clinical trial of the Pfizer vaccine.
We reconnected with infectious disease expert Dr. Monica Gandhi after speaking first in late May about if we'd need boosters. At that time, COVID cases of then yet to be named Delta were first reported in Texas and Louisiana.
Let's kind of calm down that dialogue just by looking carefully at the studies.
Now the studies are out. 76 pages from the FDA and Pfizer analyzing Pfizer's booster trial data. Another from Israel's health ministry, where adults over 60 have been able to get boosters for a short time, and a new major study in the New England Journal of Medicine looking at Israel, which showed a third dose prevented infections and severe illness in adults 60 and older for at least 12 days. What does the Pfizer and FDA data that is being looked at in this meeting show about how good a booster can help protect against Delta?
Well, that's a great question, because I looked at the FDA document that they're going to be reviewing from Pfizer, and it was because they really couldn't go there with all the mixed data with observational and epi studies. It was pretty much an antibody-based study. What they said is, we have shown that if you give a third booster, you're going to get a 50% rise in neutralizing antibodies. And we know that the Delta variant needs these high levels of antibodies. An antibody-based only study is likely to not convince an FDA that knows about immunology. So I don't think that's going to sway them very much. It's just showing some antibody-based data.
Lindsay Thies, Newsy, San Francisco.
Here to talk with us a little bit more about that story and all things vaccines and things related to COVID-19, as she has done during the duration of this pandemic, is Newsy's Lindsay Thies. Lindsay, first and foremost, thank you for being here. The big issue here seems to be the debate between boosters or doubling down on getting vaccines to the unvaccinated. Can you break some of that down for us?
Yeah, absolutely. I mean, I think it boils down a lot to the fact that science aren't robots, right? CB, we have opinions. Scientists have opinions just like everybody else, and we're hearing them more now than I think we have at any point in time during the pandemic. So a lot of what we're hearing are not necessarily discussions about the science itself and about the data, but rather things like how boosters will play into vaccine hesitancy, or what role that might play in something like vaccine equity, not just across the United States, but across the globe.
One of the things we've heard about is how fast the science is moving on this. How does the speed, or does the speed complicate things? And how does it complicate things if that's so?
Yeah, it definitely makes things a little bit more convoluted at the very least. To give you an idea, especially with this week, with that Lancet article that's come out, some of the New England Journal of Medicine studies that came out very towards the end of the day yesterday, Dr. Monica Gandhi and I were rescheduling and reshuffling when we would break down some of those studies and data, because there are so many different variables. And when you're talking about something like vaccines, and especially boosters, with the level of vaccine hesitancy that's out there right now, the way that we're communicating that data and that information and the science is so important. So you want to make sure that you get it right.
Last thing for you, the FDA is going to meet tomorrow. What can we expect from this meeting? What are some of the likely outcomes from this meeting?
Well, I would be really surprised if we saw something as simple as boosters for all, everyone's going to get a booster. I don't think that that's going to happen. I think, one really clear thing to understand too is that the FDA's role is really to decide, can a booster be approved? Can a third dose be approved? Is it safe? Does it work? Then the CDC comes in, and they're the ones that really decide who should be the individuals and the populations that should be getting a third booster dose.
With the CDC meeting next week, I guess we can go ahead and pencil in our chat for next week. Newsy's Lindsay Thies, always here to spit facts. Thank you so much for joining us.
Always a pleasure.
All right, this next one is for the sports fans, especially if you root for the Carolina Panthers. After the break, we'll give you a rundown of what you need to know before heading back into the stands.